When will the COVID-19 epidemic in America be over? First, a little bit about the science of testing that relates to the question. The PCR test, most frequently used to test for COVID-19, is very sensitive and can detect the viral RNA many days after a person has stopped being infectious, as determined by attempting to culture the virus from that individual. If the virus cannot be cultured, then the viability of the infection likely does not exist from this inability to successfully culture the virus. It occurs approximately 8 to 11 days after COVID-19 symptoms start. That is, the virus loses its viability. The PCR test sensitivity appears to be the likely explanation for the individuals whose COVID-19 symptoms have long ago ceased and yet they retest positive. The question of when will it be over can be answered on two levels. The first level is when the phased reopening starts on a state-by-state basis using CDC's guidelines. Using this criteria, when the mortality rate drops below 0.3 per million, that is, a daily death rate due to COVID-19 of less than 300 per 100,000 of state population. This occurred on April 27th in California, according to the website Talkmira. At that point, a phased reopening takes place over 90 days, with increasing activities allowed each 30 days if the death rate each month remains below the rate just cited. This means social distancing, contact tracing, and other public health measures will last up to 3 months post-peak dates. Prediction programs estimate that the spread of COVID-19 on a global scale will end by December 2020. Other prediction models show the infections bouncing up and down into 2021. An illustration of both models are shown later in this talk. The second level of an answer to when will it be over is the herd immunity related answer. The two illustrations shown are related to the Center for Disease Control's public health measures to slow down the rate of COVID-19 infections. That is, flatten the curve of a graph of infections versus time. This is done by requiring different restrictive measures for the population, primarily shown by the graph with different colored curves representing different restrictions and their predicted results. The phased reopening just discussed is potentially related to the up and down changing infectious rates shown in the illustration with repeating peaks and valleys. After the initial peak and steep decline due to strict measures, then each reopening phase produces a smaller peak, then some restrictions are re-implemented and the infections decline. And this repeats until herd immunity is fully achieved. In the model shown in the graph, it predicts sometime after September 21st we'll reach herd immunity. Sorry, I meant September of the year 2021. The simplified herd immunity answer to when will it be over is when 50 to 60% of Americans have been infected and have developed antibodies to COVID-19. At that point, COVID-19 will change from the current epidemic, that is, increasing, to becoming endemic, meaning stable, not increasing in the population. These 50 to 60% numbers are derived by epidemiologists by measuring the infectious rate of COVID-19, which is thought to be one infected person on average infects 2 to 2.5 other people in the U.S. This infectious rate is called R0 or R0. The infectious rate is then applied to a simple equation, shown in the illustration, which transforms infectious rate into a percent of the population that must acquire antibodies for the virus to stop increasing its spread in the population. One can see from the illustration shown that if R0 is 2.5, then 60% of the population must acquire antibodies through being infected or by way of a vaccine for the virus to stop increasing its spread. The infectious rate is different for each virus type, or sometimes for the strain of a given virus, and it is also affected by the density of the likely contacts with other non-infected people. This is why you see a range in the illustration for COVID-19. One can see why limiting contacts through social distancing, stay at home, can temporarily change the infectious rate, R0, to a number less than 1. Interest in R0 has grown so intense that a video of Angela Merkel, the restrained German chancellor, who also happens to have a doctorate in quantum chemistry, explaining the variable has been viewed over 9 million times. It was posted on Twitter video by someone else. Thanks to this animated video by Shanae Blau of thecorrespondent.com. The animation shows by example, when the infectious rate is 2, that is, R0 equals 2. The left side shows before the 50% herd immunity is reached. And the increase at that point is exponential. On the right side, it shows after herd immunity is reached and R0 drops to 1. The world is still far from herd immunity for the coronavirus, according to Popovich and Sanger-Katz. In New York City, which has had the largest coronavirus outbreak in the United States, that means COVID-19, around 20% of the city's residents have been infected by the virus as of early May, using antibody testing to determine that information. By deduction, about 1/3 of the needed 60% to achieve herd immunity has happened in New York, as in May. Even though it might take up to 2 years with some seasonal starts and stops for America to reach herd immunity, due to the spreading infection and the resulting protective antibodies, if it takes the same amount of time to produce a relatively safe vaccine, likely Big Pharma and its supporters will claim that the vaccine stopped the spreading infection. Even though knowledgeable individuals know that the main component of the herd immunity was approximately 60% of the population developing antibodies due to the infection. If Big Pharma develops a vaccine that works long before natural herd immunity is achieved, is reached, and it is used on people who have not developed antibodies already due to the infection, then their claim may be justified if that occurs, if that scenario occurs. To make things more complicated, a report on May 5th, 2020 says, a new strain for COVID-19 confounds the immunity issue. Scientists say a now dominant strain of coronavirus appears to be more contagious than the original. The mutation identified in the new report affects the now famous spike on the exterior of the coronavirus, which allows it to enter human respiratory cells. The report's authors said they felt an urgent need for an early warning, so that vaccines and drugs under development around the world will be effective against the mutated strain. If the pandemic fails to wane seasonally as the weather warms, the study warns, the virus could undergo further mutations even as research organizations prepare the first medical treatments and vaccines. Without getting on top of the risk now, the effectiveness of the vaccines could be limited. Some of the compounds in development are supposed to latch onto the spike or interrupt its action. If they were designed based on the original spike, they might not be effective against the new coronavirus strain, the study's authors warned. Scientists at major organizations working on the vaccine or drugs have told the Times that they were pinning their hopes on the initial evidence that the virus is stable and not likely to mutate the way that the influenza virus does, requiring a new vaccine every year.
The references and illustrations related to this video can be found on the website bigagbigchem.org by clicking on the bold red link in the middle of the page.